Hello, everybody, and welcome to another Tuesday night in the Spotlight. Tonight, I have joining me Dr. Russell Kennedy. And Dr. Russell Kennedy is the medical doctor who has a unique theory that he uses to understand and treat anxiety. If you've ever struggled and failed to find relief from chronic worry in the past, Dr. Kennedy knows exactly how you feel, as he lived with anxiety for decades. After years of frustration pursuing traditional treatments, methods, with little success, he took his unique perspective of being an anxiety patient and an anxiety doctor to take his recovery into his own hands. Dr. Russell Kennedy takes his scientific training and degrees in medicine, neuroscience, and developmental psychology and combines them with deep insights from his experiences with psychedelic medicines and the study of the spirit. The result is a revolutionary theory and approach that will have you controlling your anxiety instead of your anxiety controlling you. And as Dr. Russ was a stand-up comic for years, you'll get some laughs along the way. His brand new book entitled Anxiety RX, which I just got yesterday actually, is available through all the big retailers and on his website, www.dr.russ.com. So thank you so much, Dr. Russ, for joining me here tonight. So excited to have you.
Yeah. The website's actually Dr.-Russ, Dr. like dash RUSS. So that's if you go Dr./Russ, you won't get it. But if you just Google the Anxiety MD, I'm easy to find.
Awesome. So can you give my viewers a little bit of a history as to what got you into being the anxiety doctor?
I grew up with a father who was schizophrenic and bipolar. So there was a lot of chaos around my house growing up. So I never really felt that secure. So I think I have a sensitive nature to start with. You know, I have a fair amount of kind of clairsentient ability as well. So it is one of those things that I think the combination of my sensitivity and then growing up in an environment that was challenging, you know, really led me into anxiety. And then as I got older, I started figuring out different ways of dealing with it. Some worked and some didn't. And then I actually became a doctor, which made my anxiety go through the roof actually. And, you know, it's just my journey of trying to find different things that have helped me because, you know, so far traditional help like talk therapy and, you know, kind of traditional psychotherapy kind of stuff, even EMDR, tapping, all that kind of stuff. It helped a little bit, but it didn't really get at the root of the problem. You know, so with me, you know, I developed this theory when I was on LSD once, and only once actually. And I developed this theory that anxiety is actually inside the body. It's not really inside the mind at all. It's reflected by the mind, but I think it's old traumatic energy that gets pushed down and stored into the body. And then it gets reflected, and the mind, being a automatic meaning-making, make sense machine, senses this alarm in the system, and then it makes up a story that's consistent with that alarm. So if you deal with the underlying alarm in your body, there's no real need for the mind to make up stories anymore because the underlying cause is gone. And what we do with a lot of therapies is we try and fix the thoughts, which is kind of like trying to fix the symptom rather than fix the underlying cause. And that's why, you know, I draw the little analogy. It's like when you've got anxiety, you've got this hole in your boat and the boat's filling up with water. Now you can bail water out, which is kind of like, you know, deal with the thoughts, deal with the symptoms, that kind of stuff. Or you can actually go down there and patch the hole, which requires you to hold your breath. And, you know, it's a little painful, but at least it fixes the problem permanently, or at least it fixes it in a way that you know that you can keep fixing it in your life, as opposed to depending on a therapist or a partner or whatever to kind of keep pulling you out of the thing. You become, as what my friend Nicole LePera calls, a self-healer.
I love that. Now, because one thing that I absolutely love and connect about with the work that you're doing is you're not just doing it from a medical perspective. You're not just doing it from a spiritual perspective. You're not doing it just from a psychological perspective. You're going from all of these different perspectives and bringing them all into one. So reading your credentials, you're a yoga teacher, you're a meditation teacher, you've got experience with psychology. You actually went to school right in the city that I live in, which is really cool for becoming a medical doctor. So what made you kind of go out and start exploring the entire world and all of the different methods that are available to people?
Because I wasn't getting any help from traditional therapy. I think I write in the book, or at least I wrote an article recently that I think I've seen like 50
You've
different.
cut out for us, Russell.
Oh, I wrote in the book that I've been through about 50 different types of healers, from traditional psychiatrists, psychologists to, shamanic healers. And I wasn't really getting much help until I really decided to take my own healing into my own hands. So I went to India. I lived at a temple there for a while. And then I got back and I did some psychedelic medication. And that's when I started seeing the alarm in my body and started, okay, well, what if we actually start dealing with this alarm in our body as a version of our younger self that needs help? So I have this theory that this alarm that's in our body that we don't see very much, we pay so much attention to the thoughts. We don't actually become aware of this alarm that's in our system because the thoughts are always overriding it. And I think that's our younger self. That alarm in our body is our younger self asking for our attention. And then when we distract away with, internet or food or sex or whatever, we never really actually connect with that part of us that needs the attention. And that part of us formed when we were younger and that we were traumatized and there wasn't an attachment figure there that could help soothe it for us. So we were on our own. So we create what I call the ego dragon, which is this big kind of mythical figure to protect us, but it constantly overprotects us. So whenever we get into a trauma again, this ego dragon kind of, fluoresces and sort of gets our juices going to the point where we can't see things anymore because we're in this fight or flight state. And when the brain's in this kind of fight or flight state, it doesn't think rationally. And you can't heal when you're, if you're being chased by a lion, you can't do an algebra problem. Like you can't heal if you're in this fight or flight kind of state. So for me, it was just like, how do I get access to the underlying issue, as opposed to just treating the thoughts, as opposed to just trying to think positive, like in the positive psychology movement. If you think better, you'll feel better, which is true for about 5 seconds. But then it's, it just comes back to how you feel. It's very difficult to think in opposition to how you feel.
Absolutely. And I feel like it becomes this cycle because then it's like this level of shame that comes in for people. Oh, now I'm not thinking positive enough. So now all of this other stuff is starting to come up for me. And sometimes you just can't think positively enough to get yourself out of what that cycle is.
Yeah. And that's why. So what I do is I like go to body-based things, put your hand on your chest, rub your fingertips together. I do this thing where I cross my hands across the midline and I touch my face. Now, before COVID, I could do this, but now, I'll make sure my hands are washed and that kind of stuff. But, if you look at the neuroscience behind it, the brain has a tremendous amount of real estate for your hands and your face. So as soon as you, cross the midline, as soon as you touch your hands on your face, like if you do this right now, like cross your hands across the midline and touch your face, yep. There's very little else you can concentrate on because your mind is overflooded with sensation at that point. And that's what I want you to do. I want people to get into their sensation and see that it's actually not that bad, because the pain of anxiety is not actually that bad. It's when we add thoughts to it that it becomes this runaway train, and I used to have this with my patients with panic attacks. When they would first start having panic attacks, they would feel comfortable and weird and flushed, and they didn't know what was going on. But as soon as they thought, I might be having a heart attack, I might be having a stroke, then everything blew up. So it's not so much the underlying feeling behind it, it's the story that we add to it. And then that story becomes compulsive, and that's the story that we keep latching onto. And then that just becomes this alarm in the body, anxiety of the mind, and the whole thing just cycles on itself, because the more we worry, the more alarm goes into our body. The more alarmed we feel, the more we worry, which creates more alarm. So we get into this alarm anxiety cycle that I call it. And it's blocking that cycle. So to block that cycle, you really have to go through the body. It's very difficult to go through the mind, because you can't stop your thoughts. Your thoughts are going to keep coming. But what you can do is you can create a situation where you focus more of your energy on the sensation of your body. And the more energy you focus on the sensation of the body and the now, the less energy that's left over to feed those old thoughts. So if before 100% of your brain was just thinking, creating all these thoughts, now you're kind of focusing yourself on your body and the sensation of it. Now at least half of it has been cut off. So you can't go in 100% thinking anymore or 100% worrying, because now you've transferred a lot of that feeling into your body. And then that becomes, you condition yourself to kind of go, I don't have to stay in my thoughts. I can actually focus on the sensation in my body. And when I do that, I gain some power over the situation, because that's one of the things about anxiety. People feel powerless to it. They don't know when it's going to end. So when you start seeing that you can create something yourself that allows that to end, then you start having some power and some control over the situation. And that reduces a lot of people's anxiety, just knowing that they have something to do that will decrease their anxious symptoms. So I think a lot of it, getting back to the original question, is I got frustrated just trying to deal with the thoughts, because just dealing with the thoughts wasn't fixing anything. It would fix it. I feel good after I get out of, a session with a counselor or a good talk with a psychologist, but it would just come right back again. So I got frustrated with that and decided I'm going to have to make a different pathway to my own healing. And that's basically what the book is about the pathway that I created for my own healing and what I created for the patients that I have, and to show them that their anxiety is actually more in their body than it's in their mind.
That's awesome. That's awesome. Now, how do you encourage clients to get back into connection with their body? Because I just going on my own experiences, I know it was about 2 years ago that I actually reconnected with my body, because it was almost like it was easier for me to be outside of my body or disconnected from my body than what it was to be in it.
Yeah. And that's the reason why people worry, is because we have all this stored trauma in our body. So why would we want to go back down there? Why would we want to go back into feeling town, down into our heart center, when it's full of pain? So what we do is we worry as a way of keeping ourselves in our heads, and we have to make the worries worse and worse and worse to keep that impetus to stay in our heads, as opposed to going back into our body, not realizing that going back into our body is where the healing is. Now, that said, it's difficult to go back and revisit those old pains. It's so my wife is a somatic trauma therapist. So we talk all the time about creating a safe place in the body, in your breath, or, can you feel the air going in and out of your nostrils? So what I do is I get people to find their alarm. So for me, when I did the LSD, I found my alarm as this kind of purple, crystalline, sharp, pressure, hot sensation that pushed up onto my heart. Now that's my alarm. Now I know it. Now I know when I get upset to look for that, put my hand over it, and just kind of reassure myself, because I do think that that's my younger self asking for my attention. And when I reassure myself like that, I put my hand on over the alarm, then I automatically start feeling better, as opposed to just retreating into my head. So then I create a safe place in my body. So I have this alarm, which tends to be overwhelming, but then you realize that there's a place in your body that's either neutral or feels good. So for me, breath feels good. So what I do is I go back and forth between this feeling in my breath and this feeling of alarm, and back and forth and back and forth. And that kind of trains my unconscious mind over the course of time that this alarm is not all encompassing. It doesn't take me over completely. There are places in my body that are actually safe to go. And that's my whole goal. And like Bessel van der Kolk talks about this too. It's not so much that we're getting people to heal their anxiety specifically. It's we're allowing them to be tolerant of it, to sit with the emotion and allow it to process on its own without creating all this story around it that distracts us into our heads, that distracts us into worry, and we never actually deal with it. It's like if I go to write a novel and every time I go to the typewriter, I have a phobia of typewriters, I'm never going to write that novel. I'm never going to get anything done, because I'm purposely avoiding the thing that I need to do. So it's first of all, finding the alarm in your body when you're stressed and you're anxious. Ask yourself, okay, where do I feel this in my body? And you're driving to get your kids, or you're late for something or whatever. Where do I feel this in my body? For most people, it's somewhere between their chin and their pubic bone. It's usually around the heart area. And it has its own little characteristics. Some people say it's very well defined and it's like a fist, and other people say it's this diffuse kind of purple haze, kind of Jimi Hendrix reference there. So it's this diffuse kind of, I can't really localize it, but it's around here and in my neck. But the more they think about it, the more they can actually itemize the qualities that that alarm has. And the more that they can define it, the more they can connect with it. And then once you connect with it, you can find another place in your body that doesn't feel alarmed. And then just go back and forth between the two. And the other thing that I get people to do is just sit with the alarm, like just sit with it and see the urge to think about it. Just watch the mind's compulsion to try and make a story out of it, to get you back into your head, to just try and say, hey, the answer is over here in your head. And it's not. The answer is just sitting with it in your body. And most times what we do is we feel uncomfortable. So we go into our thinking. And we, like I said, we never actually get sitting with it long enough for it to metabolize, for it to kind of feel through it, for us to develop a sensation that it's uncomfortable, but it's okay. And you'll find that it's uncomfortable and it's okay, provided that you don't add the thoughts to it. Because as soon as you start adding the story to it, then it gets out of control. But if you can just sit with it and kind of see where it is and just see if it has the message for you. You know, it may not. And it took me a couple of years to really sit with it long enough for it to kind of tell me what was going on. So I think that's the main thing is going into your body, feeling it from there. And I'm not against talk therapy. Like people, I am not against talk therapy, because you do need a story that supports what happened to you. Absolutely. But what I feel we do most in therapy these days is create this story, and then people just sort of, use that as the structure of their lives. This is what happened to me. So this is why I'm like that. And in a way that's true, but it doesn't have to be. It doesn't have to dominate your life.
Yeah. I love that because I know in my therapies and stuff that I've experienced, it's almost, there's no beyond what you're talking about. There's no, it's just, this is your story, finish line.
Yeah.
That's it. And we're so much more. And you actually talk about that in your book, that your anxiety is not a bad thing. And you are not doing anything wrong as a person just because you have this anxiety, which I think is so encouraging for so many people, because what I experience when working with clients and what I've experienced myself is a shame that comes along with having anxiety.
Yeah. Shame is probably the most, the strongest supercharger of anxiety, for sure, because what it does is it really just splits us from ourselves. So I have this thing that I talk about in the book, is the 9 ways that your ego dragon, trying to protect you, actually splits you from yourself. And one of the ways is self-judgment. If you judge yourself, if you abandon yourself, when you judge yourself, you abandon, if you blame yourself, if you shame yourself, if you can't receive, if you detach from love, like there's all these things that happen to us that we do as a protective mechanism, but only make the problem worse. So really, it's all about a separation from yourself. That's really what anxiety is. All anxiety is truly separation anxiety. And I don't even like the term anxiety. I much prefer people use the term alarm. Because if you go out for lunch with someone and they don't know what anxiety is, and they say, how are you doing? It's like, I'm feeling really anxious today. They probably won't know what you're talking about. But if you say, hey, I'm feeling really alarmed today, everyone's been alarmed. Everyone knows what being alarmed feels like, and they can kind of relate better. So that's why I like that term better. I would love it if we would call generalized anxiety disorder generalized alarm disorder, because that's what it is. It's a state of alarm that's in our system that, affects our brain so that we can't think properly. And the thing about that is that we get into our survival brain, we get into our limbic system, and we shut off safety. And that's, we have this Stone Age brain in this digital world. And when we get into this alarm state, we are focused on danger because, thousands and thousands of years ago, we had to be. But most of our problems now are mental. They're not physical. They're not something we can run from or fight our way out of. So what I try and do is I try and get people to stay in that kind of calm, relaxed state, and learn how to create that for themselves. Because if you can create that for yourselves, you can start to heal. If you can start to create this feeling in your body that this feels uncomfortable, but I'm going to stick with it, then you can start healing. Because every time you go into the feeling of being uncomfortable, you run away from it. Like I said, you'll never develop a place where you're comfortable enough to heal.
Okay. Now, because you are a medical doctor, and I have a lot of experiences with clients and stuff who have approached their doctors asking for help with their anxiety.
Right.
And a lot of times they're just throwing some medicine and let's
Uh,
give this a try. Come back in a couple of months and we'll see how things are working. So, how would you suggest for people to be able to talk to their doctor about bringing the whole body, mind, and spirit into the medical world in terms of the doctor can actually understand or take focus on?
yeah, I don't think they can. I don't think medical
Okay.
doctors have the capacity to. It's not how we're trained. It's not how we think. We think in a very reductionist symptom control type way. We have 7 to 10 minutes with every patient. So it is one of those things that I don't think, one of my little jokes is, don't go to the hardware store looking for peanut butter because you're not going to find it there. So it is one of those things that medical doctors aren't trained in trauma at all. Psychiatrists are to some extent, but medical doctors, GPs aren't. They don't know much about trauma themselves. They certainly don't know how to heal trauma, certainly in a professional sense. And so you're going to the wrong people, unfortunately. The people that I find that have the most training in trauma are like somatic experiencing therapists. Peter Levine's work. My wife is a somatic experiencing person. Hakomi is another one. Like, these are all body-based kind of therapies that in medicine, we don't even touch. Like, we don't even come close to it. So a doctor, when you go and see them, they don't have the ability to deal with your trauma anyway, right? They can empathize with you, but they really aren't trained, GPs especially, they're not trained in being able to treat trauma. And because they come from such a reductionist mind-based place, they're going to give you medication. And I'm not against medication. I think medication is life-saving for people. In no way am I against medication. I'm just saying that you're not going to get that sort of trauma release from a medical doctor. Even psychiatrists, they really don't. They're just starting to embrace it now. And now with psychedelics coming into the fore as far as psychiatry goes, they're just starting to see this kind of body-based old trauma that's held in the body rather than just looking at, the problems of the mind. And I'm a neuroscientist, right? So I know about the hippocampus. I know about the beta nucleus of the striatum terminalis. I know about all these different, the social engagement system. I know, but that's the reflection of the trauma. It's not really where the trauma is held itself. Now, we can get into all sorts of problems because you can't separate the mind from the body. You can't do it. But it's a great concept for those I talk to who have anxiety to go, look, this is in your body. You're making it worse with your mind. So can you just sit in your body with this discomfort and just realize and just watch your mind and watch it try and make sense of this by creating these, warnings, what ifs, worst case scenarios all the time to try and explain this thing. And rather than doing that, go at it at its source. Like, put your hand over the place where you feel your alarm, reassure yourself, really sort of say, look, I know this is difficult, but I've got you. I'm here with you. We'll work through this together, because like I said, all anxiety is separation anxiety. And if you can bring yourself back together, if you stop judging yourself, if you stop abandoning yourself, if you stop blaming yourself, if you stop shaming yourself, if you can start to receive, if you can stop resisting, if you can stop detaching from people that want to connect with you, all these things will start getting you into a place where you can start healing. So, and that's basically what I talk about. So that's what I'm saying is medical doctors don't understand any of this. Like, none of the stuff in the book I learned from being a medical doctor, or I learned in medical school. I learned it from interacting with patients, for sure, because I have this framework on things that I look at things differently. But none of the stuff in the book I really learned from medicine. And I even say that at the start. I said, this is not medical advice. Most of the stuff that I learned and I know doesn't come from medicine. It comes from my interaction with my patients, but it doesn't come from the way I was trained as a medical doctor at all.
Wow. That's crazy, actually.
Yeah.
It's something that I guess I just assumed that they would have some sort of even an hour worth of training in to understand that.
Not when I went through, maybe they've changed that. I know when the adverse childhood events study came out, they started embracing it, and I got into I got into a little thing because I'm a car screamer, not so much anymore, but I used to be. Like when I was really frustrated, I would go into the car and start screaming. So they have this thing called the adverse childhood events. I don't know if you've
Yep.
heard of it. It's a study.
Yep.
So I'm looking at this, and the doctors are starting to embrace this in a way, and I'm getting angry because it's like, you guys have no idea of how to deal with trauma. So what are you going to do? You ask about all this trauma that these people have had, emotional, physical, sexual abuse, and then you've got 10 minutes. What are you going to do in 10 minutes when someone says they were beaten by their older brother for 5 years, or they're assaulted by their dad since the time they were 2? Like, what are you going to do with that as a GP? Because you're not trained in it. So when they started embracing this sort of adverse childhood events thing, I got upset because it's like, you guys are not trained in this, and you're going to wind up re-traumatizing people because you don't know. And so they're opening up this big can of worms. They're not trained in it. And, as a result, doctors want to help. I'm not against medical doctors. I love doctors. But as far as trauma goes, they are not experts by any means at all. They're not well trained in it. They don't know much about it. And they want to help, so they give medication, which in some cases, when I gave people antidepressants, I wasn't so upset when they didn't work as when they did work. Because when they did work, people didn't want to deal with their underlying conditions anymore, the underlying trauma, to actually get free of it for good. They were just happy with the fact that they weren't anxious or depressed anymore, but they weren't feeling much of anything, and that's one of the issues that I had with antidepressants. For some people, they worked well. People seem to be able to still feel and that kind of thing. But in most people, they kind of numbed them out a little bit. And, they kind of put a blanket over the underlying problem. So there's no need to deal with the underlying problem anymore because, it feels better now, so I don't have to deal with it. And subsequently, they're dealing with it for the rest of their lives. So I get a little down on MDs because they just don't know. They just don't know how to deal with trauma, and they're not. And I don't blame them at all. They're trained in a medical model where you give pharmaceuticals. So there's really no need for them to learn trauma. Now it's changing. There are some doctors now that are really starting to embrace, things like yoga and things like, Tai Chi and just sort of body-mind connection. They're really starting to see the connection between the body and the mind. But they're so steeped in that training of reducing things down to medication and to the brain that I don't know if they're ever really going to be able to see it enough to be able to treat it properly, in my opinion. I mean, they'll have their opinions as well.
Absolutely. Now, we have one woman that's saying she doesn't think anyone who has not experienced anxiety can understand it. And I know this was something that you also brought up in the book, is that if you look up what is anxiety on Google,
yep,
you get kind of a whole plethora of different ideas of what anxiety is.
You do. Absolutely. Yeah. So, yeah, I mean, I'm not sure if people do know. I've explained it to people. Have you ever had, a medical, not you personally, but I say to people, has the person that doesn't understand anxiety, have they ever, had a biopsy that, they were worried might be cancer, or, dealt with a sick parent or a sick child, or like an acutely sick child, or, you heard there was an accident and, you had to go to the hospital. Like, that's basically what anxiety feels like on a chronic long-term basis. So, in a way, I think she's right. I don't think people that don't know anxiety really don't know how to deal with it. They don't know how to empathize with it. And they think, well, just snap out of it. Just think better, just think positive thoughts, that kind of thing. Because the limit of their experience is the limit of their own minds. If they've never experienced it, it's really hard for them to really relate to it as far as that kind of stuff goes. And that's why I read it in the book. And I use so many patient examples as well. It just makes people feel like they're not alone, because this is a very an increasingly common issue, especially with, Trump in the States and COVID and all these things. People who wouldn't be anxious, because they've gone through they would go through their lives without being tremendously stressed, are now going through a period of acute stress. And the ones that were on the borderline that kind of would have squeaked through life without getting anxiety have now been pushed over into that anxious realm because they've experienced this tremendously anxiety provoking incident. But, I don't know if there is a way of explaining to people what anxiety feels like if they haven't, and that's the thing, is people don't know too. I have lots of patients who had anxiety and didn't know. It's like the patients with the panic attacks. They feel this flush and they feel this really weird sensation. They wouldn't know it was a panic attack until I started explaining to them exactly what it was. And then they would kind of go, okay, that's what it is. That's what I'm feeling. So a lot of people don't even know what anxiety is. They just feel this strange feeling like they're not in their bodies, or, they can hear their voice echo in their heads and all that kind of stuff. That's anxiety. But a lot of people don't know the label. And because, like I said, it's a laundry list of different symptoms, it's really hard to pin down.
Absolutely. Now, sorry, I just had a thought there and it's just escaped me. Oh, that I was going to go back to that. When someone is trying to support someone with anxiety.
Yeah.
Okay. And I'm a mom who has one child who does experience quite a bit of anxiety. So what is the best way to support someone who is in anxiety? Is it to help bring them back to a place of center within their body? Is it to listen to them?
I think it's both of those things. I think it's really allowing them to be seen, heard, and loved. That's really, give all anxiety a separation anxiety. It's a fear of not being seen, not being heard, and not being loved. So if you can show them, I see that you're under some problem. If you can help them find their anxiety, find their alarm in their body, like, where do you feel this in your body? Like, is it your son or your daughter who struggles with it?
Daughter.
If you can ask her, like, I know you're feeling anxious right now, hon. Like, where do you feel it in your body though? Is there somewhere, in the center of your body? Like, if you really just close your eyes and you really focus on it. And a lot of times they'll sort of go, okay, yeah, and I get people to describe it, does it have a color? Does it have a shape? Is it sharp? Is it dull? Is it hot? Is it cold? Does it have a texture to it? Is it like, crunchy, and as a medical doctor, I want to have a seizure when I talk about this kind of stuff, because it is kind of this ethereal stuff that, like if your doctor ever asked you if you're in the emergency, with the appendicitis, does your pain have a color? That guy would be out on his ear so fast. But I would just get her to connect with that place, because that's really the epicenter of the alarm in the first place, is this place in the body that it's held, and then I get all sorts of parents going, my kid's anxious, did I do something wrong? Have I scarred them for life or whatever? My friend Mark Wolin wrote a book called They Didn't Start With You, which is all about inherited family trauma. Yeah. So, we can have kids that are traumatized from, our own parents and their parents, and it's showing up now in scientific studies of non-coding RNA, that, Holocaust, the children of Holocaust survivors tend to have a very exaggerated stress response, because then they feel like that was passed down, even though they were, raised in North America, they, had stable environments, all that kind of stuff, but they still inherited this trauma. So, getting back to your original question about your daughter, it's really sort of seeing her, hearing her, and loving her. And then sometimes, you can go over and just, when you find it, you can put your hand in, ask her, is it okay if I put my hand on this place of alarm? And then she can put her hand on top, and then you can put your hand on top of that. It's just feeling this connection. I mean, that's really what it comes down to. It's not so much about, your dad, I'm just making stuff up here, but your dad's not paying attention to you and you feel bad about this. It's not really that. It's really about having that sense that no matter what, you're connected physically to me. You talk to her, you're connected physically to me. You're connected to yourself. You can do this when you're on your own, when you're lying in your bed, if you're feeling anxious, put your hand on it, just really breathe into it, slow things down. Move out of your head. Like, can we get into sensation here? Can we rub our fingertips together? You can even get her to do that thing where, you cross your hands across the midline and you rub your face, because really just say, hon, I just want to bring you into the moment right now, because all anxiety is about the future. Like, if you look at all worries, always about the future. And if you can bring yourself into the moment, that's when you can, and that's what I tell all my patients too, is just ask yourself this question in the middle of the day or the middle of the night if you're freaking out. am I safe in this moment? I may have, a talk to do to the parent teacher association at 7:30 tonight, or, an exam to write tomorrow morning, but are you safe like right now? Like if you wake up in the middle of the night, am I safe in this moment? Like in this moment right now that I'm in, am I safe? And for a lot of people with anxiety, that's life-changing, because they go through their lives going from one anxious place to the next. They never actually settle into a place that's actually safe, that they don't come to a conscious examination that they're in a place that is actually safe, even if it's just for the next 5 seconds. It breaks that cycle, because a lot of people with anxiety have this hypervigilance, and they're always, they're always waiting. They may be calm, they may be sitting there having dinner or whatever, but there's part of them that's always waiting for the other shoe to drop. So when you consciously make an effort to show yourself in this moment right now, like even you and I talking right now, in this moment right now, are you safe?
Yes.
And really sit with it. And you can say that to her. Like, I know you're worried about boyfriend, exam, school, friends, all that stuff. I know you're, but in this moment that you're in right now, are you safe? And that's a cognitive thing as well. So it's just like the first thing is to ground her in her body and see if you can put your hand on it, see if she can find her alarm. So ground her in her body first. And once she's grounded in her body, or at least as grounded as you can get, then you can start going into the thought part of it. So I really, I see the potential conflict of saying, am I safe in this moment? People say, well, that's a thought. You're not supposed to think. And it's like, yes, you're right. If there is only one thought you can have, though, that's the thought to have, is, am I safe in this moment? And then really develop a sense that you are safe in the moment, like a feeling, and really confirm to yourself that in this moment, you are indeed safe. In an hour, it could be different or whatever, but in this moment, you are safe. Because what you're training your unconscious mind to do at that point is realize, hey, you know what? We actually are safe for the next little while. And, that gets me into a whole other thing, is that anxiety people tend to create chaos in their lives because the anxiety keeps them out of the feeling in their body. So, it's kind of a complex topic, and I talk about it in the book as well. But we create chaos because if we create chaos, we're trapped in our heads, right? If we create chaos in our heads, we don't have to go back into that uncomfortable place in our body. And so we're then you're caught between a rock and a hard place. You can't heal because you're keeping yourself, it's like having a little Band-Aid over something that helps temporarily, but it doesn't create any long-term healing. So the long-term healing comes from sitting with the feeling and being okay with it, as much as it hurts. When you add the thoughts to it, that's really, that's the thing, to bring out of any of the interviews that I do is just realize that you can handle the feeling if you don't add the thoughts to it. The feeling itself is uncomfortable. Absolutely. No one's ever died from it. It's one of those things that you can handle the feeling as long as you don't, it's when you add the thoughts to it, that's when it becomes unbearable. So I get people to go into sensation, because the more you go into sensation, like I said earlier, the less brain power you have to keep ruminating on those thoughts. And then you teach your brain consciously and unconsciously, there is a place to go that's safe. There is actually a place to go. And then you get at the underlying cause, which is this alarm that you've stored in your body. And then you can start chipping away at that and metabolizing that and healing that, because that's healing at its source. The CBT stuff that you kind of convince yourself that you're safe, and, I'm not afraid of flying because there's only a 1 in 26 million chance that I'm going to crash or whatever. If there's a 1 in 26 million chance that you're going to crash, people will fixate on that 1 in 26 million. It's not a rational, your brain is not rational. And that's the thing. And we keep thinking in therapy that, oh yeah, if they come to the realization that, they were okay and they were abused by their brother because, it was his problem, it wasn't theirs, that all of a sudden everything will fade away. And that's not what happens. It helps a little bit, but it's not what happens. The problem is this energy of alarm that is stored in the body that flares up, that causes this reaction of the mind and the body. And then the whole thing just starts recharging itself. So when you get alarmed, you start thinking bad thoughts. And then you believe the bad thoughts, creates more alarm, which creates more negative thinking. And the last thing about that is that when you create alarm in your body, you go into survival brain. And when you go into survival brain, you don't see the positives, because evolutionarily, we were built to look for threat when we're stressed. So we actually filter out cues of safety when we're stressed. So if your body is alarmed and there is someone coming at you that's very soothing and comforting or whatever, you may not be able to appreciate them or connect with them because your body and your mind are so fixated on finding the threat. So that's another way that our brains work against us, is that we can't even see the positive, because the way that our brains are designed is that when we get stressed and we get alarmed, we start preferentially looking for threat. And B, the worst part about that not a lot of people talk about, is we start filtering out cues of safety. We stop seeing safety and only see threat. So how do you think that's going to go?
Doesn't go well.
Yeah. Yeah, true.
That's so interesting, because I know I can picture, just as you're talking, times where you spiral out
Yeah.
of, and I'll have people say, no, but this is good, or this is good. And then you just kind of
Yep.
point out all of these other things that really aren't that good. So it's good to know that it's just a brain thing.
Yeah. And it's consistency too, because your brain doesn't like inconsistency. So if you're feeling alarmed, you're going to look, and the way I explain it to people is, if you're in a high rise and you're up on the 44th floor and you look over the railing, your body will start going into alarm, right? Now that's normal. Now, if you're at a playground and you're watching, you're pushing your child on the swing and your body is going into that alarm, that's not normal. So that's the thing, is there's an incongruence or a dissonance there. So you feel all this alarm and you're looking around and you're like at a movie, or, out for dinner with the family or whatever, and you're feeling all this alarm and you're in a completely safe environment, which makes everyone feel so much worse, because it's like, look, I'm just out for dinner. I'm just driving, to my friend's place. Why am I feeling such alarm when there's nothing to be alarmed about? Which knocks people off balance even more, So it's realizing that, yeah, my mind is just going to give me a story that's very consistent with how I'm feeling. So it's up to me to recognize that and just go into my body, go into sensation, because that's the only safe place to go, is sensation. None of your thoughts other than, am I safe in this moment, is going to help you. Although your mind will scream at you like it has the answer, but really all it does is have more of the problem.
Okay. Now, this makes me wonder too about empaths. So those people who are picking up on these sensors and stuff from the people around them, how does that play into anxiety?
Empaths, I think a lot of the time, myself included, had to read a parent for their own safety, right? So I had to read my dad. So what I did was I lost sense of my own self, and I devoted much of my energy into reading other people. Now, like anything, it's the skill, so you'll get better at it. So the number of people who are clairsentient, psychics, whatever, who had childhood trauma is through the roof. It's like the number of comics that had childhood trauma, comedians. It's the same thing. So when we learn to be people pleasers, to be able to control another person's environment and read another person, we lose ourselves. We lose that sense of ourselves and we split from ourselves. So we start people pleasing, and they do throw us some crumbs. The people that we help, definitely, they're appreciative. They show us some love in some respects, but it's not enough. It's not enough. It will never be enough. So I think a lot of us empaths had to read a parent, and we became very skilled at it. And then because it's a familiar skill for us, we translate into that to everyone. We help our friends, we help our children, we help our friends' children. It's just part of what we're familiar with. And Freud called it the repetition compulsion. The urge to repeat something in our childhood because we equated that with security. And if you're a people pleaser and you had to read a parent, you will equate that with security. So you will do it as often as you possibly can. And then people will come to you, and you have, I'm sure you have this, people, on the street or whatever, come up to you and they start telling you their deepest, darkest, issues. And it's like, look, I just met you, man. Like, what are you talking about? I mean, you can't say that to them, but this is what happens because we do emit this energy of, we're feeling all the time. And I have a lot of people who have anxiety who don't know when they have to go to the bathroom until it's just, it's way overdue. If they don't know when they're hungry until they're absolutely starving, because they've lost this sense of their own bodies, how to read themselves, because they're so in tune to reading other people. Wow. And a lot of it is coming back to yourself. And when you do that, when you read other people to the detriment of yourself, you split from yourself, and that is fertile ground for anxiety, depression, OCD, all that stuff.
Yeah, absolutely. Now we have one lady commenting that she struggles going into her body. And when she's anxious, her body goes numb. Her legs, her fingers are numb consistently, but it gets worse when she's anxious. So do you have any thoughts for her?
Yeah, I mean, I would really consider having like a guide, like a Hakomi or a somatic experiencing practitioner, someone, because we can't do it for ourselves. I mean, there's a certain amount we can do for ourselves, but we can't do it all for ourselves. And the reason why we're stressed is because we didn't have the parent there or this attachment figure in the first place. So trying to do it for yourself is almost impossible. So it's really having that guide that you can kind of resonate off of. And it's like the mother and the baby. When the baby first gets born, I used to deliver babies. So back in the 90s, when I started, practice, we would take the baby, cut the cord, take the baby, put them over, weigh them, wash them down, that kind of thing. And now what we do is, as soon as the baby's born, we put it on the mother's chest, because that's when that social engagement system starts to connect. And it starts that early. So we use another person's nervous system to ping off of. So if you have a really skilled somatic experiencing practitioner, they can join with your nervous system and show you how to feel safe. And then once you're unconscious and your brain starts sensing that and your body starts sensing that, that there's a safe place to go. You may not be able to repeat it on your own, but if you have more sessions with a good SE therapist, they'll show you how to reproduce this in your own body. And, it's a trust issue. A lot of us didn't trust our parents for some reason. I mean, because they were either, there or not there for us. And we go into alarm. So, for a lot of people, we shut off completely. We dissociate. So a lot of the times, like what this woman is describing, if you're numb all over like that, I would really suggest that someone else helps you. And not a talk therapist, like not someone that's like, oh yes, I was abused as a child. I'm not discounting that, because I think that's an important to be able to have that story and to be able to understand what happened to you. But really your healing comes from being able to reconnect with your body. And that's, if I could put that on a billboard, it'd be like, reconnect with your body. You really have to do that. And you may not be able to do it on your own, because when you were younger and that support figure wasn't there, you learned that it wasn't there. And part of you believes that it's still not there, but it's always still there. You just have to find the right person to help bring it out.
Awesome. What exactly is somatic experience therapy?
There is a Peter Levine, who's in his 80s now, I guess, and he's still doing it. But it's basically, he developed this type of therapy that finds trauma in the body. And he also looks at, repetitive movements. Like if I say, for example, said my aunt used to abuse me and I always used to have to protect myself. My aunt, I didn't have an aunt that abused me, and he watches the movement that you make, because sometimes those movements, he says, that they need to complete. So sometimes what he'll do is he'll see the person have that movement, and then he will get them to finish the movement, to go all the way through that movement. And that helps it kind of almost, because it completes in the body, it helps the mind complete it as well. And it's about really finding the trauma in the body and then connecting with it. Because a lot of the trauma, when we find the trauma in the body, we've been disconnected from it for so long that it's very difficult to reconnect with. And it shows up in, numbness and tingling and not being able to feel. So it's this gradual process. And I talk about this in the book about the stone cutter, like the stone cutter hits the stone like 100 times before it cracks open. So it's a matter of, sometimes you're going to have to go in and try and connect with that alarm, 10, 20, 30, 50, 100 times before it finally cracks open and says, okay, I'll let you in. because the reason why it sort of froze you out in the first place is because it was in too much trauma. It went into a freeze response. So it doesn't trust, right? That younger self that's frozen in there in your alarm on some level doesn't trust. So it'll take a while for, and just sort of showing it over and over and over again. And that's why another therapist can certainly help. That's when you start developing this relationship with this trauma that's held in your body. And when you do that, when you connect with yourself, then you can start overwriting a lot of those old pathways of, I need to look after other people more than myself. I need to resist things. I need to just, I need to just really be connected with myself and allow things to flow through me, as opposed to, resisting and shrinking down around it.
Awesome. Now, one question that I always ask everybody that's on here, if you could share one piece of wisdom with the entire world right now, what piece of wisdom would you want the world to hear?
Just not to think. You don't need to think. Thinking is overrated. Thinking is something that gets you into more problems typically than it's worth. There's a place for thinking. Absolutely. We need thinking to solve things. We need thinking to make better jet engines and, to make Candy Crush and that kind of thing. But we don't need to think as much as we are. And I think we're really losing touch with the feeling of life, because the feeling in our body is where life is. And if you don't feel your body, you don't feel life. And so it's just the thing that I would put on a building is, stop thinking and start feeling. That's the advice that I would give to everyone. Realizing that, of course, some people have trauma and feeling is not safe for them. So and then in that case, it's finding someone that you can feel safe with, a therapist or, a partner or whatever, and have them help you get back into your body. That's basically what it comes down to, because thinking is not going to save you. In fact, thinking is probably going to make you worse. Probably 98% of the time, thinking makes you worse.
I love that. Not that the thinking makes us worse, just to stop thinking, because yes, we absolutely do it way too much.
Yeah. Stop thinking and start feeling, and just and realize that if you do hold trauma in your body, feeling is going to be uncomfortable, and that's okay. So that the natural response is to go back into thinking. It's like, no, you've made this leap into your body. Stay there, even though it's uncomfortable, if you don't add thoughts to it. And that's the thing that has saved me more than anything else, is like, I can feel uncomfortable. That's okay. But if I start thinking horrible thoughts, that's when it becomes a runaway train. And it's teaching yourself that the feeling is uncomfortable, no doubt, but you can handle it as long as you don't add feeling or thinking to it.
Absolutely. It has been an absolute pleasure talking to you. Thank you so much for joining me here tonight. For anyone who's interested, Anxiety RX is available on Amazon. That's where I got my copy. You said it's available in all major bookstores, correct?
They're just starting to print it at the end of the month. So Amazon is right now the only place that it's available.
Okay, so Amazon.ca, they've got the Prime Day today, so that makes it even better for everybody.
Yeah, cheaper.
Go and get some sales and get the book as well. It's been an excellent read so far. I'm only a couple of pages in, but it's a very easy to connect to book to read, and there's humor in it, and there's emotion in it, and I highly recommend it based on the 9 pages that I've read.
I try to make it funny. I think that's the thing when you're dealing with a heavy subject like this. And humor does get you into your body. There's no two ways about that. It gets you into the feeling. So I was a stand-up comic for more than a decade, and I do put a lot of humor into this. And some of it's kind of irreverent, but it's just who I am. I'm not the conservative. I mean, I am. There's part of me that's very conservative, doctor-like, but there's part of me that I've got a bit of a weird side too. So thanks for having me on, Catherine. I really appreciate it.
Awesome. Thank you. And thank you to everyone who joined us tonight. We'll see you next Tuesday.